Health policy is often discussed either at a level so abstract that it feels irrelevant or so emotional that it becomes exhausting. In both cases, people disengage, not because they don't care, but because they can't see where their understanding actually makes a difference. The purpose of this series is to examine how health policy decisions in the United States are framed, funded, and communicated, and how those processes shape outcomes regardless of political intent. Rather than advocating for specific programs, candidates, or ideologies, this series focuses on identifying patterns, how trust is built or lost, how complexity can clarify or conceal, how rhetoric diverges from operational reality. These patterns matter because health policy is not a single decision or law. It is an ecosystem of incentives, funding mechanisms, administrative choices, and public narratives. Once those systems are in motion, outcomes follow whether or not anyone agrees with them. Why this matters now. Many people sense that something about healthcare feels increasingly unstable, but struggle to articulate why. Costs rise without explanation. Coverage changes without clarity. Experts speak, but confidence spreads faster than evidence. This series does not assume bad faith. It assumes systems under strain. Understanding how those systems work and how they fail is more useful than reacting to any single headline. It allows readers to recognize warning signs earlier and to distinguish noise from signal when stakes are high. What this series will and will not do. This series will examine policy outcomes without assigning personal motive. Use real examples to illustrate structural dynamics. Move deliberately, one concept at a time. Include guidance on what signals matter and where influence exists. This series will not offer voting advice or endorsements, react to breaking news, reduce complex systems to villains or heroes, use parody or satire to make its case. The goal is understanding, not alignment. How this will unfold posts will be short enough to digest in one sitting and structured to build on one another. You do not need to read them all at once, and disagreement is expected. The series begins with a simple question. How did health policy become a trust problem? Before examining any administration, crisis, or reform effort, it is important to understand why trust weakened in the first place, and what happens when it does. That is where the series begins. Next, trust became the weak point.